Hey, it's me. Thought I'd do a quick video. Today is Wednesday and it's fill day, and today will be probably my penultimate fill, unless, because I asked him last week and Dr. Falady, and he said that I can go to 550 and still get 600 silicone gel implants put in, but I've been looking to see how the size works, and because of the weird placement, because there's the big gap in the middle, I mean, you can't really tell. I'm not going to show. This is not show and tell. Anyway, because of the big gap in the middle, it's like, and the way they're immobile. I went on the trampoline yesterday, and that was fun because nothing moved except for me. So that was fun. Yeah. So I don't know. I mean, it's hard to gauge. I've been looking at pictures of boobs online, but these are like the breast augmentation pictures. Again, it's hard to gauge because these are natural breasts, even if they're very, very small. They're natural shaped and they still have nipples and stuff. It's so weird because when I went to an appointment a few weeks ago with Dr. Falady, he said that the breast surgeon, Dr. Blanchard, had left a little bit of the areola on the left side, which was the affected breast, and I thought, how can you tell? Because I don't see anything. Obviously, it's in the incision line, but that at that point was all red. Oh, I'm going to look on the camera, but I don't know. I haven't really. I took some pictures yesterday because I forgot last week. I didn't do my weekly pictures for my own, use. Not use, for my own reference, and I didn't really look to see, because I haven't been putting the Benadryl on the dry, the bits that were like left red from the tape, from the extra stitches. I'm not going to say fillings, stitches I got, but it's not been. I haven't had the itchy thing for a while now, so that's good. What was I saying? Oh yeah, about the areola. So he said that. So anyway, a few days ago I was cold and I thought, oh, I'm getting goosebumps, and you get goosebumps, and if you have nipples, the nipples get all stuff puckered up and things. So I thought, I'll look in the mirror like you do, and I saw goosebumps on the left one, but I didn't see anything on the right, which is really weird because there was no goosebumps at all. It's like, what's going on? Why is there nothing? So that was weird, but I don't know if he's going to. I don't see it. I don't know what he's talking. The one thing that I've noticed that really bugs me. Oh, I haven't got a necklace on today. Because I did my hair the other day, I forgot to put one on. The roots, they were irritating me. I noticed in the last video that there was like all this darkness on the parting, and I'm like, oh no, gotta cover that up, get rid of it. So something that's really irritating me is that, and I do love my hair, I've said that a million times, that's one, that is my favourite thing about this. So the thing I hate is that, because I straighten my hair, and even if I don't, because I straighten my hair, it's really like straight. Duh. But it gets in between, and that area is really super sensitive. Probably because it's one of the few parts that have sensation. No, actually, I've got sensation here and here and there. But it's super sensitive down the middle, because it's the area like down the middle is where it's. I don't want to show much. But it's where it's been sewn, the muscle has been sewn to the chest wall, and it's become super sensitive. I don't know why. Can you see like the the lumpage, I mean the angle, it looks so fake. This does not look like boobs. And seriously, they are hard. The thing I did last week with the knocking on the table and on the boob, you know, see? They don't actually sound like they're made of wood, but they're pretty solid. So yeah, yesterday I finally, I mean it's been 6.5 weeks, I started doing weights about a week and a half ago, which is the reverse of what I did with the abdominoplasty. I started doing weights later, obviously, because part of my doing weights is doing the my lower body and my core muscle workout as well. So I started treadmilling yesterday and thought I'd ease in, so I did an hour, same speed as before, 3.3 miles an hour. I thought because of the band that's right underneath the boobs that gets really tight, that I might get a bit tired from it or out of breath, but it was fine. So I did an hour, and so that's a good way to start. I think I'll stay with an hour for now, and then go from there. But I was excited to actually get on the treadmill. It felt good, and I was reading, testing to see, you know, after I get the cataract thing done, how far I'm going to be able to... Oh, shoot. I decided the other day that what I'm going to do is... first eye is done on the 20th of April, second eye is done on the 4th or 5th of May, I forget. And what I'm going to ask Dr. Fallady today is to see if I can get the swap out, get the implant. I'm also going to ask him about, what is it called, gummy bear implants. They're the newest. Oh, and there's the shaped ones. There's different shaped ones that you can get, apparently, so I'm going to ask him about that today as well. But I'm going to ask if I can book the breast swap out, the breast implant swap out for, and he's going to redo the pockets. Oh God, I don't want the hair to get in the middle. For about a week after I have my eyes done, because since I'm going to be incapacitated visually, sight-wise, I might as well just get the other thing done as well. That way I'm going to be incapacitated, not be able to see unless I had a guide dog, and for 4 weeks. So I might as well go through the recovery thing with the breast surgery. Hopefully it won't be as awful as the actual mastectomy thingy. And I've heard that it's not as bad. I hope not, because it was horrible. But who knows? So I thought I'd coincide it, so hopefully by the 8th, 9th, 10th of May I will have it booked. And Oliver said, why don't you do it for the 13th? And I said, no, my luck, it would be a Friday the 13th. And he said it was I haven't looked, but he says it is Friday the 13th in May. So I said, yeah, no, I don't think so. Yeah, I got a couple more of my birthday presents in the mail the other day. One of them doesn't fit my head, and I have a big head, and it doesn't fit my head. I was really disappointed, but I'll show you anyway. See, it does not fit my head. So it will be a cover for my heater in my room. There. The other one is pretty cute. It is pretty cute. I haven't put up my Minions wall art yet. Grown woman wearing this kind of crap, really. I think it's cute. Look, it's a Minion. The Minion with the one eye. I don't know, you know, for a Minions enthusiast, I don't know their names. But I think it's cute. He's pretty cute, and he's got these little thingies, whatever they're called. Pom-pom, whatever, and you tie it up and it's so cute. Oh, and I got that. Oh, and Holly got me this from an Etsy store. Yeah, Etsy store. It's like a little hair thing with Minions. And she got me a scrunchie made with a breast cancer fabric. And she got me this. Oh, my nails, I redid them again in the pinks, but with the holographic Revlon holographic pearls over the pinks. I got lots of the pinks, so I can keep going pink. She got me these Minion nail decals, which I will do. They're so cute. Yes, thank you, Holly. Take the hat off, woman. You're not a child. Okay, so yeah, so there's that. I did my hair this weekend, as I said, because it was getting so bad. Also, I got these dresses from Amazon, sundresses. Makes it so easy when I go in for my fills. I go in, I just pull the top down. He does that, and I'm off. Well, I pull the top back up, and then I'm off. So it takes a few minutes. But I got them from Amazon, so I'll show a little bit. This is one of them. This is like, they're sundresses. The bottom of it has these little rose things. I've had them before, and because they're so easy, and the one bonus, I mean, there aren't many bonuses about getting breast cancer and having a bilateral mastectomy, but one bonus, the bonus that I can see is that at the moment, because obviously these things are, boing, boing, no movement at all, I don't have to wear a bra. And as much as it didn't bother me, because I wasn't uncomfortable, there's a certain level of freedom about not wearing a bra. And I can go out, I can be not wearing a bra inside the house. I used to sleep in a bra so that the girls wouldn't end up down on my lap. But I can go like 24 hours a day without wearing a bra. I can go outside, not wear a bra, not worry about it, other than one of the dresses that I bought the other day. They're cheap. I mean, they're cheap. I'm not going to lie. They're cheap. And I put one on, and the elastic went on the top row, because there's lots of little rows of elastic. And it went, and then it wouldn't hold up. So even the straps are kind of loose. But that's the one benefit. But the downfall, of course, is the cancer. But the other downfall is that I'm still not sleeping well. I am sleeping in little bits and pieces. I'm tired. Maybe getting back into treadmilling again will help that. So I'm tired, I can't sleep, and everything seems to set me off. I can't watch anything on the television, I can't read anything, because it sets me off. And I know it's still been only 4 months since I found out I was diagnosed, and I went through bilateral mastectomy and all that. I kind of feel that, I got off lightly, even though I've had the mastectomy and everything. And when we were at did I mention this last week? I don't know if I mentioned this in the last video, but when we were in the doctor's office last week, there was a lady that came out of the rooms at the back, the whatever it's called, and came out and sat down in the waiting room, and she was with a friend, and she's obviously going through breast cancer, because he has a lot of breast cancer patients. And she kind of looked, and as she was coming out of the door from the examination rooms, and she had this expression on her face, and maybe I misread it, and it's very possible that I misread it, because I'm just everywhere emotionally right now. But it kind of felt to me, maybe it's the fact that I've always felt that my tummy tuck was a vanity surgery. But you know what? That vanity surgery prompted me to getting the mammogram for a breast reduction surgery in a year or 2 or 3 or whatever. And that's how we found out this diagnosis so early. So the vanity surgery that I got probably was the best thing that came out of that, other than the fact that, I really feel, even as numb as I still am in my abs, and as much as the seroma came back and has come back on my hip from the breast stuff, I don't know, I can't feel bad about it, because it's probably done me a huge, huge favor. But anyway, we were at the in the waiting room at Dr. Fellows, and this lady came out and she gave me this look, and I thought, she probably thinks I'm there, for a vanity consultation or whatever, because I have hair. I don't have a Belisha beacon saying, oh, she's had her breasts removed. Maybe, I should get one of those T-shirts that said, that say, my breasts, yes, they're fake, my real ones tried to kill me. I've seen it on Amazon and on breast cancer sites and stuff. Maybe I should get one of those. And I'm sure it's going to be obvious when I have these, because I'm not really, these things don't, I'm not wearing anything that, because of the odd shape, because I've still got like skin, I'm not wearing anything that's going to show the shape of them, but at some point it's going to be obvious that they're fake, because I don't know. I don't know, but anyway, there's no, Wade and Holly were at the supermarket the other day, and they were waiting in the line, and there was a lady behind them that was obviously going through chemotherapy because she had no hair, and she didn't wear a hat or a scarf or a wig or anything like that, and she was getting some stuff, and they were comparing what they had in the carts, and she was with her husband or somebody, and it's just easier to be more sympathetic towards, and I'm not asking for sympathy, I'm really not asking for sympathy, but I don't want to be looked down on either, because of the fact that I didn't have to get chemo, and it's from people that are going through the same kind of thing. Of course it's not the same because I didn't get chemo and I didn't get radiation, but then I opted for a radical surgery so that I wouldn't have to have radiation, and that's not the only reason I did it. Chemo was one of the reasons I did it, because why am I justifying why I've made the choices that I've made? Anyway, I do often wonder if I made a mistake because of the fact that this is so uncomfortable. I look so bloody. I look like a mutant when I don't have my stuff on. And I'm still, at this point, I'm still early days. It's only been 4 months, and that's probably one of the reasons that I can't sleep, is because my mind is always going 10 to the dozen about this whole experience, which is never a fun experience. I don't know. It's just a lot of things, like all of a sudden, out of the blue, a lot of things just get to me. I should be grateful for the fact that it was what it was and we caught it when we did, and it's been, the way it's been. I get to see an oncologist for the first time this coming Monday, and then we'll discuss whether I have to go on tamoxifen, which is an estrogen hormone blocker, which originally, with the lumpectomy, I was going to be on it for 5 to 10 years, because that improves your decreases your chances of getting it by 50%. But because I got the mastectomy, I may only have to be on it for a year or two, or not at all, I don't know. But anyway, I get to see an oncologist on Monday, and we'll discuss that and other things that are going through my mind, and maybe I should start taking something on a regular basis to sleep, because I need to sleep, because I just cannot function on no sleep. But anyway, I thought I'd do an update, and I said it anyway about 50 times there, and I just cracked my knuckles, and again. So I hope you're having a better week than me. But I'm not having a bad week, I'm just having the kind of weeks that I've been having for a while. Anyway, hopefully, and she says it again, I will not get too much pain from the filter today. I might actually ask him to do 75 cc's and then be done with it at 575, and then if he puts in a 600cc implant on each side, then he does that. He's going to obviously have to reshape these things and redo the pockets, because frankly I don't want my boobs at the sides, I want them in the front, and I want there to be less of a gap in the middle so that I don't have my hairs going in there and tickling that very sensitive area. So that's it for today. I hope that you're having a good week, and I will see you next time, and maybe it won't be so freaking miserable and I won't say the F word, which I almost said just before. Okay, thanks for watching. Thumbs up if you blah blah, whatever. Bye!